and thank you for joining us today. Over the past week, the eyes of the world have focused on the political and security changes in Afghanistan and the consequent emergency evacuation of international and vulnerable Afghan civilians. We all watched scenes of chaos and desperation at Kabul airport with grave concern as men, women, and children risked their lives and some tragically died in efforts to flee the country. But it is important to note that even before these latest events, Afghanistan was the world's third largest humanitarian operation due to war, displacement, drought, hunger, and of course the COVID-19 pandemic. Over 18 million people, more than half of the population, already need humanitarian assistance to survive. And these needs are increasing daily. As the events quickly unfolded, we had two priorities. The first was to ensure the absolute safety of our staff in country. We have taken a range of steps to increase the security and protection of staff and their dependents, including relocating thousands of Afghan colleagues and their families out of harm's way to areas away from conflict. The second priority was to stay and deliver by continuing our life-saving work for the millions of Afghans left behind. This means prioritizing the delivery of life-saving health supplies that health facilities need to stay operational. We rapidly distributed life-saving supplies to health facilities and partners in Kabul, Kandahar, and Quds. But WHO now only has enough supplies in country to last for 1 week. Yesterday, 70% of these supplies were released to health facilities. More than 500 metric tons of medicines and supplies remain in our warehouse in Dubai. They were ready and planned to be delivered to Afghanistan this week. But Kabul airport remains closed to commercial flights. And based on operational and security constraints, countries sending in empty planes to pick up evacuees do not feel they are able to help. A few days ago, we made a joint call with UNICEF to the international community requesting support to deliver humanitarian supplies to Afghanistan. This includes the immediate establishment of a reliable and robust humanitarian bridge to send in supplies. Looking forward, we will also work with the Afghan people and partners to ensure that the health gains of the past 2 decades are not lost. Over these years, WHO and partners have worked with authorities on multiple advances for the health and well-being of the people in Afghanistan. Together, we strengthened a better health system by training healthcare workers and delivering life-saving and essential medicines, medical supplies, and medical equipment. We monitored and responded to disease outbreaks, scaled up the trauma care program, and ensured that services of women, mothers, and children were available even in the most remote and hard-to-reach areas. As a result of the collective work of many partners and thousands of healthcare workers, the number of women in Afghanistan dying in childbirth has reduced by 60%, and child mortality has reduced by over 50%. Almost 70% of all women now have a chance of surviving to the age of 65, compared to only 54% 20 years ago. It is important than ever to keep building on these gains so that every man, woman, and child in Afghanistan has a chance to live a life filled with dignity, good health, and hope. Additionally, Afghanistan is one of only 2 countries in the world that has not eradicated wild polio virus, with only 1 case of wild polio virus reported from Afghanistan and Pakistan each so far this year. Now is a critical time and an unprecedented opportunity for the program in Afghanistan to stop polio and not to lose the hard-won gains achieved. We also need to keep the COVID-19 pandemic under control. Both Delta and Alpha variants have been documented in Afghanistan, and we are concerned that the current upheaval and increasing population movement could lead to a spike in cases. With less than 5% of the population fully vaccinated, the conflict is impacting COVID-19 vaccination across the country and delaying routine immunization, which could lead to further outbreaks. As the current events continue to unfold, WHO is fully committed to staying and delivering in Afghanistan. Today, WHO has a network of 684 staff and health workers inside the country, working on all 34 provinces. Despite the challenges and ongoing insecurity, they remain committed to deliver on our collective mandate. And they are being supported by specialized teams at all levels of the organization. We now need the support of our donors and partners to count on us, to work with us, and help us to save lives, promote health, and serve the vulnerable. Colleagues, I would like to end my remarks with a message to the people of Afghanistan. For 70 years, we have been serving you, and we remain with you. We stand in solidarity with you, and we place your lives, health, and well-being as our top priority, based on our regional vision of health for all by all, a call for solidarity and action. We will not let you down, inshallah. We will not fail you, inshallah. So thank you very much for this opportunity, and I wish you all the best. Back to you, Muna.
شكرا جزيلا دكتور أحمد المنظري، وأجدد التحية بالسادة المتحدثين اليوم: الدكتورة رنا الحجة مديرة إدارة البرامج بمنظمة الصحة العالمية لشرق المتوسط، الدكتور ريتشارد برينن مدير الطوارئ الصحية الإقليمي بالمكتب الإقليمي شرق المتوسط، والدكتور دامين لو ممثل منظمة الصحة العالمية في أفغانستان، والذي سيقدم لنا الآن بيانا حول الوضع الحالي في أفغانستان. تفضل دكتور لو. Unmute yourself, please.
Dear colleagues and friends, greeting from Kabul. Since last week, WHO has made several assessments to review the health situation on the ground. Apart from a few days of political and security changes, most major health facilities are functional and accessible. This including health facilities supported by WHO that provide trauma care to injured patients. However, health facilities across the country are experiencing critical shortage of medical supply. Our assessment review the service delivery is being supported by Taliban Health Authority without any pressure on health staff. Health workers has been called to work, return to work, or remain in the post, including female health workers. However, some female health workers are not returned to the post, and some has resigned from their position due to ongoing insecurity situation. Both male and female patients are seeking health services, although some female patients are also fearful leaving their home unless a life-threatening condition. Our crowded among displaced people has limited infection prevention measures and increased risk of transmission of different infectious diseases, including COVID-19. The country has already gone through 3 substantial waves of COVID-19. We are concerned the new spike among displaced people that could lead to further transmission across city and due to very low vaccination rate. Only 5% of the population be vaccinated so far. This will place an enormous burden on health system, which is struggling to cope escalation trauma and emergency cases. and could leave some of the most vulnerable people without critical life-saving health care. WHO is working with health cluster partners to monitor the situation and scale up COVID-19 surveillance, testing, vaccine, and vaccination for displaced people to mitigate risk or increase transmission. Afghanistan reported over 150,000 COVID-19 cases, more than 7,000 deaths on 23rd of August of 2021. However, there is a decline of testing due to insecurity. The testing rate last week declined 77% in both public and private laboratory compared to the week before. As a result, we know there are underreporting of COVID-19 cases. Instability put some key measures to strengthen COVID-19 response on hold, including establishment of new laboratory for testing, installation of oxygen plant in hospital, and expansion isolation wards, ICU bed for COVID-19 in different provinces of the country. It also makes implementation of infection prevention measures extremely difficult across the country and impact COVID-19 vaccination program. As well as COVID-19-like symptoms among displaced people, we also report increased cases of diarrhea, high blood pressure, reproductive health complications, and malnutrition. As need increase, we continue working in coordination with health partners. 6 medical team has deployed in Kabul to provide life-saving emergency primary care service to more than 100,000 displaced people. 14 medical teams are deployed to provide health services in the east region of the country. Overall, more than 3,000 medical consultation was provided last week, including outpatients, antenatal, postnatal care, immunization, and screening for malnutrition. 130 WHO support trauma care health facilities remain open, provide case management services. Critical polio surveillance activity continue largely undisrupted. The polio vaccination continue to be administered to children through permanent transit point, including the friendship gate between Afghanistan and Pakistan. In past week, WHO delivered trauma care, basic medical supply, and calorie kits to health facility in the 6 provinces, including Kabul, Kunduz, Herat, and Bayan, and Kunduz. This supply enough to cover urgent medical care for more than 200,000 people. Medicine and supply were also dispatched over 2 weeks to 22 malnutrition centers, treating children with severe acute malnutrition. Additional supply for 48 more malnutrition centers are waiting for distribution. The past week has been challenging on both personal and professional level of WHO staff in Afghanistan, but we all commit to staying and delivering. Health service must be continued without interruption across the country. There is urgent need for reproductive health, mental health services, hygiene kits for newly displaced people. Nutrition supplements are needed to address recent malnutrition among children, especially those affected by conflict. COVID-19 and other routine immunization, including polio vaccination, must be continued without interruption to control infectious disease, prevent secondary health emergency. And injured people, including women and children, need trauma care as well as longer-term rehabilitation to prevent lifelong injury. Mental health services are also needed now more than ever before. For us, to continue our life-saving work. We call on all parties to respect the neutrality of health, ensure critical health activity are not disturbed. We need to sustain unimpeded access for supply to enter the country so that we can keep health facility functioning and have services available for all. During the difficult time, there have been all civilians, as well as the safety and security of our staff in Afghanistan is paramount. Thank you.
شكرا دكتور دابن. وننتقل الآن إلى الأسئلة التي تلقيناها من السادة الإعلاميين، وأبدأ بسؤال للدكتور أحمد المنظري يقول: ما هي حقيقة الوضع الوبائي في أفغانستان وكيفية التعامل معه؟ وهل تؤثر الأوضاع السياسية الراهنة على الحالة الصحية العامة في البلاد؟ السؤال من كريم مسعد، قناة CNBC العربية.